everyone for logging into our Wellness Wednesday live webinar. This is a platform focused on health and wellness with guest speakers and specialists answering your questions. Thank you for being on this journey with me today. My name is Zarmina, and I'm delighted to introduce you to our speaker of the day, Dr. Kavita. Dr. Kavita is currently working at THB as a physiotherapist and has done her Master's of Community Physiotherapy from Maharashtra University of Health Sciences in India. Her master included core subjects such as women's health, industrial rehabilitation, and geriatric health. So excited to talk to you today, Dr. Kavita. How are you doing?
I'm doing good. Thank you for inviting me for this webinar.
Absolutely. Well, this is the first time we are talking about physiotherapy as a topic. We feel the time is right. There's so many questions around this area of health, and we're excited to jump straight into it.
Yeah, sure.
Great. Well, I think let's start with the definition of physiotherapy. It is known as the treatment of disease or injury through physical methods. Some, however, may have a limited understanding of the true scope of physiotherapy. Could you share with us what this really entails?
Yes, surely. So physiotherapy basically is treating any diseases with help of exercise therapy. We have electrotherapy. Apart from it, we use new techniques like manual therapy, soft tissue mobilization, and we have very wide courses we have BOBA for neurophysiotherapy. We have different courses in it and different school of thoughts which we use in getting the person functional, independent, and the main thing is relieving the pain what they are suffering. The scope is very wide. It's not only treating any orthopedic problems, but it goes to neurological issues like stroke, ALS, myasthenia gravis. Then coming to pediatric would be cerebral palsy, muscular dystrophy. So that is a few part of neurological physiotherapy. Then coming to the other field is we have branch in cardiopulmonary rehabilitation. So that would be training or rehabilitating, building up endurance and strength of your heart and your lungs. So like post-surgical, we can go like bypass surgery, or if there is any angioplasty done. And coming to pulmonary conditions like chronic obstructive pulmonary disease, restrictive disease, and now the very much going is the COVID.
Right.
So post-COVID, your lungs become very weak. So we have to regain the endurance and the strength of your lungs. So we have one branch in there also. Sports physiotherapy is there, women's health, which we are going to talk in detail. And we have industrial rehabilitation coming, geriatric, pediatrics. So it's a very wide scope. Like we come everywhere to getting back to functional and minimizing the disabilities, preventing disabilities. So it's everywhere.
Absolutely. I think you touched upon such a key point. It's a very wide scope. And I feel that perhaps most of us didn't even imagine that physiotherapy can address so many areas of health issues and concerns and conditions. And I think that's our goal for this session. We'll try and cover as much as possible. Let's start with defining ergonomics and how we can reduce risk factors to our physical health through focusing on ergonomics.
Okay. So ergonomics basically means work laws, like the postures which you use and do by your work. And it's not only just limited to working people. It can be also for the housemakers. Okay. So basically we evaluate the posture of a person while they are at work, and this posture can be because of their workstation also. Generally, if you have a good working station, you are in a good posture. But if you have a poor workstation, somebody tall sitting in a cramped place, so you will have a bad posture over there. So we evaluate the workplace and the posture of the worker and accordingly give suggestions to them. Now, ergonomics, like you see in the picture, if you're considering the IT worker, so if you're generally we tend to sit in this way, and we keep stressing our neck, our upper back, and slowly because of that the lower back also gets strained.
Right.
So if you are in a correct posture, you will not get any pain. So what happens is when you are in a poor posture, the few of the muscles are overworking, and those minor injuries become a major one later.
Right.
And you will have poor posture. Like even if when you're standing, probably you might have a habit of standing like that.
Right.
And this minor injuries may lead into a major problem later.
Right.
Likewise, it's not just related to the IT workers,
Right.
like lifting up something heavy,
Right.
like for example, the workers working in the warehouses.
Deliveries.
Deliveries. So how to pick up a load?
Mhm.
Like if the company could provide them some hoist or some mechanical instrument which will
Right.
make it easier for them,
Right.
giving less harm to their joints, their back. So this is how ergonomics come into the picture.
Right. I think you mentioned that it's important to address it because it might be small at first,
Yes.
right? But if you do the same thing for 5, 6, 8 years, maybe something as simple as carrying a heavy bag on my right shoulder every day. If I'm doing that with my laptop, my books, that these little things can have a snowball into a
bigger one. And also what happens is the companies should take interest in this, because ultimately their production would reduce.
Mm-hmm.
So a small investment in the beginning would help in the long term.
Right. Health of the people and health of the company as well.
Exactly.
Absolutely. No, that's a great point. And let's go a little bit into the orthopedic conditions and injuries that physiotherapy can help address. I guess some of it may overlap with the ergonomics type of pain and chronic pain, but can you give us a rounded picture of that?
Yeah, sure. So orthopedic, like everybody nowadays know about back pain, neck pain. Most of them are having knee pain during the old age, frozen shoulders. These are a small sort of cases here, but then we are also involved in surgeries, ligament injuries, then rehabilitation, the entire thing, post-fracture, when you keep your leg again on the floor the first time, how much weight has to be given, how do you start walking with the walker first, and then gradually moving on to the crutches, canes, and then finally walking, running around. So all this would be a part of orthopedic. So like it's really very vast. Any kind of bone injury or ligament injury, like probably some might while bowling, or they might dislocate their shoulders, gymnasts. So all this are the part of orthopedic problems.
Okay, and I think that you mentioned at the start chronic pain, right? So back pain, knee pain. It feels like this is something that's unavoidable, right? It feels like at some age everything starts to hurt, and you feel it with every passing year. Is it inevitable, or is there something we can actually do to prevent this? Is it a fact of life we all have to accept?
No, so we can prevent this if you do regular fitness from the beginning, regular exercise. But exercise, I mean, under the guidance of some expertise. Like I've seen people going to gym hitting because they are very conscious about their body, probably want 4 packs, 6 packs. But if you're not hitting on your core and you're directly working out on your abs, then it's going to eventually hurt your back. So we need to have the exercise done under a proper guidance. And yes, if you are doing regular exercises from the beginning, your muscles are strong enough, this is not going to come in. Until and unless you have fall or you have any injury. That would be totally different. But the chances of injuries also reduce because your muscles are strong, supporting your bones. So your receptors are working, then your reflexes would be faster. So it's not just related to the muscles, but we have receptors in our muscles sending messages to the brain. So when your muscles are strong enough, your reflexes will be faster. And if you are fit, exercising regularly, mentally also you are aware, so you can avoid any kind of injuries too.
That's such a good point, that you can avoid or prevent the risk. What I also learned in my personal experience is if you maintain a certain level of activeness and fitness and exercise, if you were to be unfortunately injured, the recovery process is so much smoother. And I realized that when I tore my calf muscle, and it but the recovery was almost beautiful, I would say, because I had almost in a way prepared for so many years to manage, an unfortunate injury, but because of my activity levels, I think sometimes people forget that, right? So it's even like you said, post-surgical. So when you have orthopedic issues, maybe you have post-surgery, that recovery period is actually not just a surgery and you go home. The recovery period could be months, right?
Yes.
It can maybe even cross a year or so. So I think it's an important reminder for people that it's not just, okay, I can walk again and I'm fine, right?
You have to be fit and
Yeah.
functional the way. That is why you're going for a surgery.
Right.
So if I can tell about knee replacement surgeries, so generally these surgeries are planned. So if they have already because of pain, the muscle, is become weak. So it's a cycle. Like you have pain, there is inflammation. So the brain sends messages, don't make this work. You reduce the movement, muscle becomes weak, further spasm, and this keeps on happening. It's a cycle.
Right.
So if you train yourself before going into surgery, the muscle strength is gained. So after the surgery, when you have so many stitches, the muscles are cut, right? So when the muscles are cut, they're going to lose their strength further. So if you are trained earlier, you have an idea what kind of exercise I'll be doing.
Right.
So you're prepared for it, and it becomes less painful.
Physically and mentally.
Yes.
Absolutely. No, that's a great reminder. And I think we all need to be aware of that and have activity levels quite high beyond aesthetic reasons, right? At the end of the day. Can you go a little bit deeper into what musculoskeletal structures and tissues do you as a physiotherapist pay attention to and work with? But also for somebody like us who may not know the difference between the tissues and ligaments and muscle and the fascia. You hear all these things, but we don't really know one apart from the other.
Yeah. So like if you come to a joint, imagine the knee joint, very simple to explain. You have one bone up, one bone down, and ideally there are two, but in the joint it is just one, and you have the kneecap sitting over it. All right. Now you have cushions here. They are your menisci, and you have ligaments in order to prevent this translation. All right. And we have the muscles supporting the joint. Okay. Now fascia is something which is between your skin and your muscle. So like that, what you see in the picture is the white yellowish part.
Yes.
That is your fascia. Okay, that is between your skin, your muscles, and it goes from one muscle to the other. Okay, so when like if you're in this section, when you are taking out the skin and you're just cutting the fascia and you see the muscles down.
Right.
So fascia is something through which your blood vessels, your nerves pass.
Okay.
So what happens is when you have a muscle spasm, so the muscle goes into spasm, so there is soreness, inflammation over there. So it will not let your fascia also move. So there will be a compression on the fascia. Okay, so once there's compression on the fascia, your blood vessels are getting compressed and your nerves are also getting compressed. And that is the reason you get those, pins and needle kind of sensation at times. And the color also changes in that. Sometimes it might become a bit darker compared to the surrounding area.
Okay.
So that is because the blood supply in that area is hampered.
Okay.
So that is one thing. Apart from it, we also work on capsules, joint capsules. So for an example, if I tell about shoulder joint, you talk about frozen shoulder. So we have, suppose this is the socket and this is the ball of your arm bone. So it is like this, and you have a covering of capsule, like a bag over it. Okay. So in order for the shoulder to move up and down, we need gliding happening here. Okay. But imagine if this is tight, this is not going to glide. So if this doesn't glide, your hand is not going to move. So we work on this capsule also. We have different manual techniques in which we give passive movements to this kinematics, that is between bone, with the movements between the bone, the sliding, the gliding, we give that manually, and we do stretching of these capsules and eventually get the movement back. But along with the movement, exercise is very important to maintain that new range of motion which we've achieved.
Right.
So it has a balance between these manual therapy and exercise strengthening part.
Okay.
Yeah.
And you mentioned the manual therapy and exercise, but at the start you also mentioned different devices that you use, right?
Yes.
And can I assume that that's because you're trying to reach different layers under your muscle, or at what stage do you need those devices? Whether that's electrotherapy, the things
Electrotherapy.
you mentioned.
Yeah. So mostly I'm a manual therapist, so I avoid using those
Right.
because I believe into manual therapy, which
Right.
would give quick results
Right.
rather than just using the electrotherapy. But certain point you need electrotherapy. For example, if I'm treating an elderly, so the bones are weak, I cannot go for manual therapy in order to release those muscles around.
Right.
So here I would be using different kind of techniques. We have TENS, that is transcutaneous nerve, electrical nerve stimulation.
Right.
We've got interferential therapy. So this everything, so it works on different mechanisms, like you can say pain gate theory. So it's like when you are sitting cross-legged, sometimes you get pins and needles in your leg.
Yes.
So that is because we have different fibers, large fibers and thin fibers, which are taking messages to our brain. So the larger fibers are going to get compressed first, and the thinner fibers, they are mainly which makes us aware of pain. So when your larger fibers are, compressed, the smaller fibers are sending those signals, and that is why you get this tingling sensation.
Okay.
And the blood supply is also, affected,
Right.
and the exudates are there, which further stimulates your small fibers.
Okay.
So it works, this electrotherapy, some of it works on this theory. So like for an example, if you have pain, you would apply deep pressure and it will relieve the little amount of pain. So there are types of fibers. So it would, when you touch, the larger fibers are getting stimulated. And it would go ahead and block the smaller fibers coming to the brain. So that is how it works.
Okay.
So what happens is, like for TENS, it is for the time you've applied, you feel better. But meanwhile, it is also, taking care of the inflammation. So IFT basically also improves in the blood circulation in that area because your muscles are contracting, relaxing. So it will drain out the exudates from there.
Okay.
And thus the pain substances,
Right.
and you have relief.
Okay.
And the other thing is ultrasound, which I often use.
Yes.
This is kind of micro massage, which goes deeper, and it helps in alignment of the muscle fibers. For example, if you tear your pants and if you stitch it somewhere, then it won't be like aligned well, right?
Yeah.
Similarly, when we have any injuries, our muscle fibers or the collagen fibers are haphazardly, repaired.
Right.
So we need to align them well. So along with when we are doing the soft tissue mobilization, we are removing this adhesions.
Okay.
And likewise, ultrasound will help in aligning the fibers.
Okay.
And at the same time, it has this micro massage thing, which will help in improving the blood supply, hence the nutrition in that area.
Yeah.
And working on healing.
Okay.
Apart from this, we've got other laser, we've got many other high voltage pulse galvanic currents.
Okay.
Then we've got electrical nerve stimulation, which is required in case of paralysis. So when your muscles are not working on its own, we have to make them contract in order that they do not lose their bulk. So if you must have heard about facial palsy, when one part of the face is not functioning, it's like paralyzed.
Yes.
So here what happens is eventually the muscles will become thinner. It's because we are smiling, talking all the time, they are working like how we work out other muscles, the same for the face.
Okay.
So here what we do is give stimulation to each and every muscle, so the property of the muscle is maintained.
Okay.
At the same time, exercises goes along. There are different types of proprioceptive neuromuscular facilitations and all those kind of different exercises. So it's not like just moving the body, but we have a theory behind that, how it has to be done.
Okay.
Yeah.
And a little bit on manual therapy. I think we hear about sports massage and fascia release, and what is the role of manual therapy? What's the difference in a regular spa kind of massage and what's happening when you're having physiotherapy treatment?
Yeah, so there's a lot of difference in it. So that the spa massage is generally relaxing, and the soft tissue muscle release is we identify which muscle is affecting the movement or is causing the pain, and we go deep inside and release those muscles. So like needling does, like you put the needles and you kind of break those adhesions inside.
Right.
And similarly, we go deep with our thumb or our elbows. So
Yes.
it is not relaxing. It is
It's
a
not.
bit
I've
painful.
been through it. It's very painful,
Yeah.
but it works.
Yes, it works
Yes.
because we are trying to create ischemia, that is reduce the blood supply or stop the blood supply for a few seconds, and then suddenly the blood comes and it takes away the exudates. That is what we are doing. And at the same time, when you are compressing and you are releasing the muscles, the adhesions are breaking. So again, the body is going to start, the healing process and align it properly. Along with it, we would apply tapings. Coming to the manual therapy, like I'm a certified Mulligan practitioner, so I follow that school of thought. So here, what we believe is there is malpositioning, and we correct those malpositions. So this is not related to chiropractic, this is something different. So for an example, tennis elbow, many of us have gone through, especially when we play badminton, instead of moving the shoulder, we use our wrist more,
Right.
and we end up having pain on the elbow. So that happens because your extensor muscles or the muscles which move your wrist up are sore and they're overworked. So what we would do is align it in a particular way and then ask you to do the movement. And whenever we do this, there should not be pain. If there is pain, we would change the direction of the glides and, probably the angle in which we are giving. So we would change that and come to a point where there is no pain. So it gives very quick relief for the pain.
Okay, great.
Yeah.
We're coming to one of our key topics of the day, women's health. Can you tell us what is the role of physiotherapy in women's health?
Well, it's a very huge thing from adolescence to old age, like each and every stage of women's life. They're going through all different changes, bodily changes, physiological changes, emotional changes. So looking into adolescence, the body image changes. So there are anatomical changes, the breast is developing. So that is one thing what I have noticed is the adolescent girls, they tend to have a hunch, because they are not ready to accept the new image.
Right.
So they tend to accept this, position.
Right.
So which might lead to back issues and poor body image when they become elder, because your muscles in front are becoming tight and the back is becoming longer. And there is sudden growth spurt, but in this bones are growing faster than the muscles. So what happens is you get back pain, leg pain, which is very common, you see in males also, but since we are in women's, so I would stick to that. Many of them even develop scoliosis, like that is the lateral bending of spine. So that is one point. And here what we would give is good strengthening exercises, stretching exercises, because when your muscle bulk is increasing, but the strength is not increasing with the same amount. Also, the fat deposition in the hip region and the thighs increases, which will make your muscles weaker. So we need to have a good strengthening program during that time. That is why, they say the kids has to be, they have to be active rather than just sitting at one place and studying.
Right.
So when you are active and, you using all the garden equipments, like hanging on the rod and going up and down.
Right.
So all that helps, cycling. So all that will eventually help in building strength and, stretching, like especially when you're hanging,
Right.
you're stretching the entire body, it's getting pulled against the gravity. So
Right.
that is very well used for scoliosis. And then moving later would be like if you go ahead, geriatrics, like we have one section in. So prevent falls, bones are weak, prevent fractures, maintain the balance, proper balance system, and all that would be there.
Okay, well, before we move on into this, you mentioned something so interesting about the hanging.
Yeah.
And this is something I feel like I've heard a little bit about recently that, if you do it, I don't know, 30 seconds a day or something like that, it actually does bring some kind of relief.
Yes.
What's the science behind that?
All right. So when you are hanging, your hands are up. So we have muscles coming from our back, going and inserting on our hand, I mean the humerus, that is the bone of our arm. Okay. So when we are hanging, our scapulae, the blade bones, they are getting pulled down. There's gravity which is pulling us
Right,
down,
yeah.
and we are hanging.
Right.
So our scapula, the shoulders are also moving down. So you get good stretch on your neck.
Yeah.
You are well aligned. Okay. You're not slouching. You are not extra. Yeah. So you are in your natural pose.
Yeah.
And you get stretched all throughout. Plus, your pelvis is also getting pulled down, so your
Right.
back is also getting stretched.
Right.
So, but one thing what we have to take care is when we go, don't just jump abruptly and hold it. You might strain your shoulders or you might hurt it.
Right.
So just always climb on a step,
Right.
hold it, and then
And then
remove
be
it.
prepared.
Yeah. Yeah, but keep it, let somebody be there in
Right,
case if you
right.
want, because if you abruptly jump down, you might harm your foot.
Right.
So that we have to be a bit
Okay,
careful.
wonderful. That's very interesting. I just thought we should spend a couple of minutes on
Yeah,
that.
sure.
So moving from women's health and focusing a little bit more around pregnancy, postnatal, can you tell us how can physiotherapy contribute to a healthy pregnancy?
Yes, so for healthy pregnancy, like during pregnancy, it's like some are very excited, but some of them get, because of the morning sickness and other problems, are irritated. So we have antenatal classes planned for them. So during these classes, like generally before enrolling to this class, we let them fill a form which is called as physical activity readiness medical examination form. So if there is any risks for in the pregnancy, we don't make them do the exercises, but they can always be a part of listening. So in the antenatal classes generally starts, so there are 2 batches, we can say. The first would be from 14th week to around 24th week. Here we would explain them what the bodily changes are happening, how their posture is going to change. And it's not only the posture or the uterus becoming big. There is changes in their, the blood volume increases, the, say the changes in the respiratory mechanism, hormones are changing. So there is relaxing hormone release for little, so that your ligaments become a little looser in order to accommodate the baby. Then so all the bodily changes what are happening, we would be explaining it to them. Then we can also they might have some problems like back issues and pubic symphysis pain. They get swelling because of the water retention, and there may be swelling in their lower limbs. So how to sleep, left side is advisable. You should not be sleeping straight. All the ergonomic advices.
Right.
Then some of them might have, tingling in their hand. Like it could be because of the compression of the median nerve. So also in the classes, there would be other women also there present. So they would make contacts through them. So when you know what is going to happen and suddenly all these changes when you're feeling, you are not overwhelmed. You know what you can do along with it. At the same time, we can have fitness for them, for those who are not at risk.
Right.
So we help to maintain the muscle strength of the pelvic floor, your abdominals, so and generally the overall body,
Right.
so that you are fit at the time of birth and the chances of normal delivery increases until and unless if there is any complications in it.
Right.
So that is the first stage of the antenatal class. The second is generally after 28 week to 34 weeks. Here we introduce them to labor. What is true labor? What is false labor? What all you will see, how you have to be, calm, the breathing techniques. Like generally we teach them, that you have to be calm and breathing at the time, but that time the pain is so high that you would forget all of these. So we make them practice, like, you can pinch the inner thigh and practice the breathing. So that pain is not going to be so much. You cannot do anything on the uterus, right? You have to go closer, probably pinch the inner thigh, and at the same time learn that breathing technique. So you will know that along with this pain, have to be calm, breathing properly, and when to push, when not to push, what positions you should be in the different stages of labor. So that is generally in the second set of classes. So that is all about the antenatal classes.
So in the first stage of the classes, you mentioned, physical activity and building muscle.
Yeah.
Is it a misconception that pregnant women should avoid activity? Should, stay in bed, don't do this for yourself, don't go and get yourself water? I feel like maybe partially it's culture related, where you want to take care of that female which is pregnant, but maybe we need to know that we should be a little bit more active in that case.
So just if there is any complication and your obstetrician has advised you bed rest, that is a complete different thing.
Right.
But you need to be active during your pregnancy. You cannot just, because if you're on the bed all the time, eventually you're going to develop back pain, neck pain.
Right.
Okay, and the body changes, you become lazy, you are weakening, your fitness level is going. Because after the baby is there, you have to be really very active. You will get less sleep. All the attention goes towards the baby. You get less attention. So if you are fit, active, and your back and your body is into good shape, the body image for your own self, you feel more confident.
Right.
You are able to take care of your baby properly, and at the same time, you do not have aches all over the body. So if you are fit ahead, you know what is to be done later, like we spoke earlier also. So that is the reason, like, you need to be active, but you should always, like I said, first we should have a clearance and then we go ahead with it.
Right. And just staying on pregnancy, what are the challenges during pregnancy that one should be aware of?
Okay, so generally the entire body changes. So the front muscles, if we see in the picture, which will come now. So here, if you see, the abdomen is increasing in size.
Right.
Okay, so on the upper picture, you see the abdomen is increased in size. There has to be a balance between your front and the back muscles. If you are holding something far, you're going to strain your back, right? So same ways here, the strength and the length and the weight anteriorly is increasing, and your back muscle is trying to control it all the time, and that is why you get those back pain. Apart from it, if you see down, the muscle, the first thing, narrow and normal. So we have these muscles like that, attached to each other, and as the uterus starts becoming the part of abdomen, these would go on stretching and it might become the second type. That is called as the Diastasis Recti. So generally, after delivery, this is there. Okay, if you just take your lying supine, you put your fingers and you take your head up, you will see the fingers inserting between two muscles. Okay. So if you're fit earlier, okay, when we are giving during the antenatal classes, we give exercises for the abdominal muscles also. Okay. So this separation will be there, but the fascia, we've got fascia, the linea alba in between, it would not be too much, like your 3-4 fingers will not go, it would be probably 2. Only when it is more than 2 fingers, it is called as diastasis recti. Okay. And now it happens in different, for few females, it would be only below the umbilicus, for few it would be above, and for few it will be complete. Oh. Okay, so that is there. Apart from it, if you see in the upper picture, the breast is also going into, it becomes large in order to develop the ducts for milk. Right. So they become large and heavy. and eventually you would go into a slouch posture,
yeah.
and that will again affect your neck. Okay, because and your shoulders. If I'm like this, I cannot take my hands up, but if I'm straight, my hands go up. Right. So wearing a proper bracery during that time. Other thing, what I would like to say is consider the pelvic bone. I do not have a picture here, but your hip bone, the big bone. Okay, the uterus is here, and this is your abdomen.
Right.
So what happens is, as this is like that, as the uterus starts growing, this is going to open up. Okay, when this starts opening, behind there is compression happening. So you might get something which is called as pelvic girdle syndrome. This front is also opening, which is meant to be closed. So that times there would be, displacement, and female might have tremendous pain in your pubic region.
Okay.
So that also physiotherapy can help in treating that pain. Going back to pelvic girdle pain is the pain not similar to the low back pain. Low back pain would be only in your lower back, but this pelvic girdle pain is in your gluteal region. You would feel more going anteriorly ahead, coming to your thigh. So that would be, we have tests in which we identify whether it is the low back pain or it is the pelvic girdle pain, and accordingly we treat the clients.
Okay, great. And what are the stages of labor and the role of physiotherapy in childbirth?
Okay, so let me first start with what is true labor and false labor. So false labor is generally those Braxton Hicks contractions, which begins with 28 weeks. That is a mild contraction of your uterus, but it's not like going to take the baby out. It's little bit there and it goes off. So that is not every mother would start feeling it that week. Some of those who are very sensitive might feel it earlier than the others, especially the second time mothers can appreciate more than the first time mothers.
Okay.
Because they know what they are experienced it,
right.
yeah. So they would appreciate it more. So what happens, how to differentiate is Braxton Hicks contraction would be only in the abdomen. That pain would not radiate anywhere, and it would be there for some time, and then it would not come back. But the true labor is the pain going from your back to your inner thigh. And every time it increases in the duration, the frequency, and the number of repetitions. So suppose the woman is getting that contraction or the pain for 2 seconds maybe, every 10 minutes once.
Right.
Later, it would be for 5 seconds, 2 contractions every 10 minutes.
Okay.
So likewise, the frequency, duration, and the repetitions would go on increasing. Okay. And at the same time, there would be some secretion or some bleeding which might happen. Okay. So that is the beginning of labor. Now, going on to the stages of labor would be, first stage is when the cervix is opening. Now, many of us are not aware of what is cervix. So if you see in the first picture, below the baby's, the fetus head, you see that area?
Yes.
That is cervix. And it is the opening of your uterus in the birth canal, that is the vagina.
Right.
Okay. So during the first stage, it is the opening of the cervix so that to prepare the birth canal, okay, so that the baby can come out. Okay. So ideally, it has to open up to 10 centimeters, all right, so that it is easy for the head of the baby to pass. Right. So every time that contraction happens, so the muscles are like coming from up and down. So every time the contraction happens, what is happening? It is pulling it away. Okay, and that is how the cervix opens. Okay. So that is the first stage of labor. Now, during this, there would be pain. So the role of physiotherapy is to, provide relaxation to the female, advise her not to push during this stage. Because this is, some of them might feel that now I have to push because it is paining. Right. But if you push at this stage, you will be exhausted by the time when you are in the second stage when the baby is going to come out. And at the same time, what happens is you might end up tearing your, pelvic floor muscles, the vaginal muscles around that. So you might end up tearing that. So we do not want that. So we would give TENS in the lower back region, which will help in preventing, reducing pain to a certain extent. Also, we give various positioning. This all is would be taught in the classes, the second batch of classes, and how to be calm, what positions you can gain. So if you go to the slide, the previous one, I've shown all the positions. The other one, yeah. So if you see the woman is squatting there,
Right.
then
And these
on
are
force.
pain relief.
So all these positions for the time when the cervix is widening.
Okay.
And it is said that the more active you are during that time, the faster it widens.
Okay.
But again, here we have to take care of the risk factors. So the obstetrician's view is always very important.
Right.
Otherwise, some of them might have low hemoglobin, and in gravity assisted position, they might start bleeding more. So we have to take care of that. Yeah, for the first time mothers, this might last for like 8 to 16 hours. And for the second time on further, it would be like 4 to 6 hours, the first stage. Moving on to the second stage is when the baby is being delivered. So for the first time mothers, it would be 2 to 4 hours. And for the second time and other, like more than that, it would be very quick. So the second stage is delivering of the baby. So here, basically, we explain them push only when you feel the contractions.
Right.
Again, TENS can be applied, but nowadays we've got epidurals also.
Right.
So this, we make them aware about how these epidurals can also help them. So it is kind of giving you analgesia, but to a certain very, the level has to be very perfect. That obviously the anesthesiologist will be knowing. So you should feel the contraction, but at the same time, you'll not feel it too much, and the pain can be avoided. So whenever you feel that contraction, you have to push. You do not have to keep pushing throughout, because these contractions come for some time, again they are relieved. Again it would come. And why does this pain occur is when your muscles or your uterus is contracting, the blood supply to the uterus gets obstructed, because the pressure of the uterine muscles increases to such a level that it is blocking your blood vessels. And because of ischemia, like no oxygen going there, that is why you get that pain. And once it relaxes and when the blood supply comes, you are relieved. And again, when it contracts, you feel the pain. So you have to push only when the contraction is there. Moving to the third stage is the delivery of the placenta is very important. So once the baby is delivered, after some time, the uterus is again going to contract in order to take out the placenta, which is very important.
Yes.
So that, and the fourth stage, now we can consider it as fourth stage, that recovery of the mother.
Right,
So
exactly. And I think that's what I wanted to ask next. Why is postpartum physiotherapy so important?
So for the postpartum is like you've delivered the baby, and then after that, we will have two categories. Suppose those who have gone for cesarean section and the other normal delivery. Sometimes in normal delivery, you have episiotomies also. They tend to cut a bit for the baby to come out properly. So considering the cesarean section first, they are not allowed to move. They are in catheter, and because they are paralyzed, the lower body. So probably after 24 hours, they would be moving. So for them, we will show them the bed mobility, how to get up off the bed, because generally they are scared that the stitches might break, and they will go into a slouch posture in order to protect the stitches. Apart from it is they cannot cough and sneeze properly, and the secretions would not come out because they are afraid that it might break and it pains. So we would teach them splinting techniques. Even while turning around, you should hold the scar and move. Okay, the stitches, they should be holding it and move. How to split them. Then going now, that would be for the cesarean, but for normal, they are moving around already. If they are strong enough, they would start moving immediately. But in case of episiotomies, if they have difficulty in sitting. So for common for both of them would be pelvic floor exercises. Though the cesarean women who undergone cesarean section, there is no the baby is not coming out from your vagina, but the entire 9 months she was holding the baby. So there was a pressure in the pelvic floor region. So those muscles tend to become weak. And for the normal delivery, yes, the baby is passed, so the muscles have stretched. There was a cut, so further, the muscles are cut and they are weak. So we teach them pelvic floor exercises, which are very important in order to avoid future prolapse, the body part coming out through there. Okay, so that is one thing. Apart from it is if you go to the slide, the feeding techniques. Okay. So how to hold your baby. Generally, the woman would hold one on the head and the other at the buttocks of the baby. Right. The baby is also not well supported. At the same time, you'll be loading your shoulders. So it's very simple. First, it may be little scary to hold that tiny baby in your hand, but once you hold it well. So the previous slide, if you go to see, there are positions like okay, so there is cradle position in which the head of the baby, can we move to the previous slide? Yeah, so this is the cradle position. Then cross cradle would be the hand opposite way. Then football hold is holding from behind. So these all are the breastfeeding positions, right? Okay, which are very important, because if you are not in a good posture, again, the baby, the breast might come on the baby's nose and the baby will not breathe. So he or she will not be sucking properly. Right. The other problems what new mothers face is latching of the baby. It is very emotional. Yes. They don't know how to do it. Sometimes the baby is drowsy and would not do it. And it's very emotional, like they think that they are not able to feed their own babies. So here we would show them what is correct latching. So the entire areola, that is the black part around the nipple, should be in the mouth and should be touching the palate of the mouth of the baby. So after that, even if you try to pull the baby's head, he will not leave it. But if it is not properly latched, little here and there, the baby's mouth. And it also depends upon the type of the nipples they have. Some of them might have flat inverted nipples, which would make it more problematic. Yeah. So yeah, we could guide them through all of that. Then again, getting back into shape. So a few women are very, energetic or very excited to go back to gym, workout. Like, okay, now it's done. Now I should go back to my routine. Yeah. But it is not advisable to lift heavy weights or do any brisk activities at that time. Though the hormones are slowly coming into level, but the effect of that is still there. So you might harm your knee joint, your back again. So it is always advisable that you go do a proper core strengthening under the expertise, and then slowly with their, if when they agree, you can go back to your gym. Right. So initially, like you will, relaxation is also important, because the baby might end up crying the entire night. You don't sleep, and that cycle, not you're tired, rest. Not enough rest, and every time you have to keep feeding them. So all that things come into the picture, and there is a lot of emotional disturbance at that time. Plus the attention goes towards the baby, so you feel less important. So all that has to be taken care. Last thing I would like to mention is mastitis. This generally happens like the ducts get the milk ducts gets clogged, and there would be swelling and pain in the breast. So yes, we need to show it to the doctor, as well as physiotherapy will help, because if there is any infection, then you cannot feed the baby at that time. and you might get fever. So we need to avoid that. So they should keep checking their breast. If they find any lumps, they can take a hot pack before feeding and ice pack after feeding. So that would reduce the inflammation. And when you take hot pack before feeding, the flow, it becomes easy. So yeah, that is
Okay, that's very helpful. So let's moving a little bit away from pregnancy. How can physiotherapy be beneficial for menopause and other related issues?
Yes, so this is also a very wide topic, but I would quickly go through this. Here again, we've got two kind of people: those who are happy that regular monthly menstrual cycle is stopped, and the others their fertility is stopped, and now they feel less woman-like, and because of reduction in the estrogen levels, there is male kind of fat deposition on their abdomen. So chances of getting obesity increases. Some of them might get facial hair, but so all this, so some it is okay, for some it's too emotional again. At the same time, they get hot flushes, very irritable. There are changes happening in the skin. Skin becomes papery and very thin, easily damaged. Then your genital urinary area also goes into a lot of changes. So the sexual activities may become painful. And the most important is your bone. Your bone, it goes into osteoporosis because of the less of estrogen. So what we do is generally we give weight bearing exercises. And if we started from, like as we said, from the beginning, if you're fit, your bones are healthy and your muscles are strong enough so that all these pain and aches will not come later. So here we would go for strengthening activities, weight bearing activities, and depending on what kind of stage they are in, we would be adding exercises, because osteoporosis would lead to rib pain. Then some of them like constant pressure on the thoracic, there will be minor fractures happening in your spine, and you might go into a hump. Then hip fractures are very common. So here we would teach them how to avoid falls. So that is why prevention of falls is one of the things. If the bones are too weak, and we would give them preventive, you have this bags which you can tie around your waist. And in case when you're falling, you can just pull it in a balloon, like how we have the airbag in your cars to prevent injury. We can have those kind of bags also.
Okay.
So when you pull them suddenly, when you're falling, you pull them, you have to be, reflexive, active, quick. So when that happens, so you will prevent the pressure on your bone and prevent from the fracture. Apart from it, if you fall down, how to fall? Okay, how to fall? Like if you are falling on your side, turn and fall on your chest maybe, because when you fall on the side, you will land up on your hip, and that is the main point where we generally see fractures in elderly. So how to fall, and if you fall down, how to check yourself and how to get up. So all this we would be teaching them. So that would be a short part of going through menopause. Irritability and all, we have got different kind of relaxation techniques. So we can teach them that. And that's
okay, great. Another commonly asked topic, or maybe a common condition that can be quite uncomfortable, is incontinence. Can physiotherapy be effective in treating incontinence?
Definitely, this is the most common problem. People are shy to come up with this. It is only what I have noticed in India is I have to keep asking them, because we know about this. So any elderly female coming to us, we would ask, like even if they come for their knee problem, we would ask them that, do you have this problem also? So that time they would reveal that yes, and probably sometimes I've even noticed once in the first session they would not tell you. When they come regularly and they're comfortable with you, then they would slowly open up. Yes, I have this problem, and that is why I avoid going out. I'm in the house only all the time. So here we've got two kind of incontinence is actually, without your control, you're just passing urine even if you want to control. So there are two types of incontinence. First is the stress incontinence. Actually, there are many, but I would give the common one are the stress incontinence and the urge incontinence. So if you see here, this is a stress incontinence bladder. So what happens is this is generally because of the weakness of the pelvic floor. If you see in the normal bladder, up when there is a pressure coming from the abdomen, but the urethra is closed, okay? So it would not, your muscles, the pelvic floor muscles are strong. So they are closing the urethra, all right? And when the muscles are weak, so whenever the pressure comes down, so whenever the pressure is coming from down and the lower part is weak, obviously it's going to leak, right? So here the muscles are not contracting strong enough to hold the urination, and the droplets, or sometimes they land up emptying the bladder completely. So this is about the stress urinary incontinence. Moving on to the urge urinary incontinence is that the brain constantly sends signals to your bladder muscles and keeps making them contracting. Okay. Now, if your pelvic floor is weak, and if you cannot distract from this, even a sound of water pouring or somebody mentioning going to the washroom, you might feel like going to urine.
Right.
And by the time you enter the toilet, you're already done. So this is what happens. So in both the cases, the first case is case of stress urinary incontinence. We have to make your pelvic floor strong. At the same time, we have to attain a coordination between your abdominal and your pelvic floor. So before the abdominals hit in, you should be contracting your pelvic floor. So putting into daily activities, if you're coughing, first hold your pelvic floor and then cough. If you're sneezing, hold your pelvic floor and then cough. Okay, so that is how you're strengthening during the daily activities, as well as the separate strengthening. For that, we've got various biofeedback also, because it is very difficult. So since we know the anatomy of the muscles, it is easier for us to imagine and contract it. But for a woman who do not have the knowledge of this, it becomes very difficult. So first, we have to make them aware of the muscles. We can use mirrors. We can use various biofeedback instruments. Then we have various strengthening, like we have cuffs and dumbbells for your hand. We've got cones for vaginal cones with different weights and grades. And we have to put that and walk and contract it so that they don't fall down. So all those are the strengthening ways. And moving to urge incontinence, here we need to distract our mind. So we can give them imaginary techniques, or count 10 till you reach the toilet. So recently I've been using this for one of my patients, and she's very happy with it. Like she's like, I can reach to the toilet till I pass my urine. So that is one of urge. Now this is not only related to old females, athletes like young females. Though their pelvic floor is strong, but the coordination is affected between the abdominals and the pelvic floor. So when they do high impact activities like, jumping or any high impact activities they are doing, few droplets come. And they don't realize at that age, and being that young, they would not even talk to their own mothers. So I would even like to inform them, if they are watching, that yes, there is a cure for this also. We need to work on the coordinations. Every time you jump, every time you do any impactful activities, you should be holding your pelvic floor first and then doing those activities. So that is how it is.
That was extremely helpful. I know we have so many more questions to get to, but I think we'll need a part 2 for this session. A big thank you to Dr. Kavita for being with us here today. And thank you to everyone who logged in to watch this webinar, who submitted their questions and comments. We greatly appreciate it, and we hope you gained some interesting insight on this session. If you'd like to see more videos like this, please subscribe to our YouTube channel. And thank you again. That was great. Wonderful.
Bye.
Thanks, everyone.